A manufactured crisis. The NHS is experiencing a severe financial crisis. Many hospitals and foundation trusts are now in serious financial trouble. As a result, services up and down the country are being cut and hospitals and GP surgeries closed. Others have been merged. As a result, ministers, civil servants and the CCGs and foundation trusts are introducing charging back into the NHS. Public services are being cut and rationed, following the advice given by the consultants McKinsey in a report to the Labour government in 2009. At the same time as the public sector of the NHS is suffering cuts, closures and mergers, contracts are increasingly being given to private companies and social enterprises. This is quite deliberate. For over 30 years now, Thatcherite governments, whether Tory, Conservative Lib Dem or New Labour, have been determined to promote the private sector over publicly funded services. Enthusiasts for private enterprise have been disappointed because there is no market for private healthcare on its own in Britain. The market has therefore been artificially created through the deliberate destruction of the public service. And the current crisis is deliberate. A 1979 Royal Commission on the NHS rejected charging. They said, "We can say clearly the NHS is not suffering from a mortal disease susceptible only to heroic surgery. Already the NHS has achieved a great deal and embodies aspirations and ideals of great value. The advances to be made, and which undoubtedly will be brought about by constant application and vigilance." In fact, contrary to the tales being spun by the Conservatives and the media, the NHS has not overspent. It is well within budget. In 2012, £2 billion worth of unspent funds were actually returned to the Treasury. The Statistics Authority has also reported that in real terms, NHS expenditure was lower in 2011 to 12 than in 2009 to 10. The result is that the NHS as a leading global healthcare provider is being destroyed. But despite regular government criticisms of waste and inefficiency, the NHS rates well above the healthcare systems of many other countries. A report by the Commonwealth Fund into the comparative quality of the different healthcare services in 7 industrialised countries found that Britain was above many of them. It was more efficient than all the others, beating Australia and the Netherlands. The American, a largely private healthcare system, which has formed the model for the NHS's privatisation, performs much worse. The US spends nearly 18% of its GDP on healthcare. This is double that of the UK, but America was bottom in the list of 16 Western countries in terms of the health and life expectancy of its citizens. That was when I wrote it. Things are very different now, thanks to the intervening years of Conservative mismanagement and deliberate destruction. It is also clear that many of the individual private companies now running the NHS hospitals themselves provide poor standards of care. Private Eye, in its In the Black section, has covered cases such as the poor standard of healthcare at the Portland and Wellington private hospitals in London. Yet the firm that runs these also manages 3 NHS Foundation hospitals, including University College London and Queen's in Essex. Private healthcare is unsuitable and cannot cope with unprofitable cases such as emergency care, the long-term and chronic sick and the elderly. Private healthcare firms around the world don't touch these cases unless they are well rewarded by a very generous contract. It is one of the reasons for the small size of private hospitals in England, most of which have only 50 beds. Most English private hospitals lack facilities for dealing with emergencies, complex care, intensive therapy, and other forms of care-intensive treatment. And contrary to the image promoted by private healthcare and its right-wing cheerleaders, it is not less bureaucratic than the state sector. Up to 40% of the budget and staff in private healthcare firms in America may not actually be medical, but clerical and administrative, including legal teams. Back in the 1990s, Private Eye also published numerous stories on how bureaucracy in the NHS was actually increasing due to the introduction of the internal market. The return of poor healthcare before the NHS. If the plans of Thatcher, Major, Blair and Cameron succeed, and the NHS is finally abolished to be replaced by a for-profit healthcare system like America, all the problems of the British healthcare system before the advent of the NHS will return. As we have seen, like modern PFI and Foundation Trust hospitals, The voluntary hospitals which the NHS replaced were also terribly financially insecure and facing bankruptcy and liquidation. Working people faced crippling medical fees which many could not afford. In America, the Observer reported back in the 1990s, during Bill Clinton's presidency, that 10% of Americans could not afford their medical insurance. Medical bills are one of the leading causes of bankruptcy in the US, and as with the American system, much of the funding of the pre-1948 medical care in Britain was done through private insurance companies. As for making the NHS funded purely by personal contributions, in which the individual receives the treatment for which he or she has paid, it was firmly rejected by Aneurin Bevan when he set up the NHS. He observed there would be problems with the qualifying period and would produce an administrative chaos. He went on, "This is already the case in countries where people insure privately for operations as distinct from hospital or vice versa. Whatever may be said for it in private insurance, it will be out of place in a national scheme. Imagine a patient lying in hospital after an operation and ruefully reflecting that if the operation had been delayed another month, he would have qualified for the operation benefit. Limited benefits for limited contributions ignore the overriding consideration that the full range of health machinery must be there in any case, independent of the patient's right of free access to it." The situation is grim, but there is still hope. People are forming groups and campaigning to stop the privatisation before it is too late. In 2013, Dr. David Owen, one of the leaders of the former SDP and now a Liberal Democrat MP, proposed an amendment to halt its privatisation. The bill was intended to reinstate the Secretary of State's duty to provide NHS health services, subject all NHS organisation and healthcare services for the NHS to ministerial supervision, repeal their self-governing status and give ministers sufficient provision over NHS services, and make delivery of NHS services the duty of monitor. Support for this bill has become the objective of many campaigning organisations determined to save the NHS. National campaigns for the NHS. Keep our NHS public, KONP. They're on the web at www.keepournhs.public.com. London Health Emergency, www.healthemergency.org.uk. NHS Support Federation, www.nhscampaign.org. National Health Action Party, www.nationalhealthaction.org.uk. Further reading. There are several excellent books available on the privatisation of the NHS, which add much more information than can be included in this small booklet. These are Jackie Davis and Raymond Tallis, NHS SOS, London, One World 2013. This is highly recommended, as not only does it describe the process of privatisation and the failure of politicians and the medical profession to combat the changes and resist this creeping privatisation, it also contains advice about what the reader can do to campaign for the restoration of the NHS. It includes the above lists of campaigns and organisations and useful books and websites for further information. David Owen, The Health of the Nation, NHS in Peril, Methuen 2014. Jackie Davis, John Lister, David Wrigley. NHS for Sale, Myth, Lies and Deception, Merlin Press 2015. Yusuf Al Gingihi, How to Dismember the NHS in 10 Easy Steps, Zero Books 2015. Alison M. Pollock, The End of the NHS, Verso 2016. Alison M. Pollock, NHS plc, The Privatisation of Our Healthcare, Verso 2004. Colin Lay and Stuart Player, The Plot Against the NHS, Merlin Press 2011. And the web. The NHS and the Section 75 Regulations, Where Next, by Bob Hudson, Guardian Healthcare Network, 30th of April 2012. http://www.guardian.co.uk/APR/2013/APR/30/NHS-Section-75-Where-Next. Conflicts of interest and NHS privatisation. Video by the National Health Action Party. http:// NHS. Take a tour of Lansley's private healthcare supporters video by Spinwatch. http://www.spinwatch-org/index.php/component/k2/item/take-a-tour-of-health Lansley's-private-health-care-supporters. The Spirit of 45, a film by Ken Loach. See http://www.thespiritofforty5.com for screenings and availability. I think this may well be over as on the national